Hi guys, Dr. Daniel here, and I just wanted to talk to you about the clotting risk factors associated with the Astrozenica vaccine, and I guess importantly, some information so you can help make up your mind whether you want to receive the vaccine or not. The official guidelines from ATAGI, which is the Australian Technical Advisory Group on Immunisation, is that patients under 50 should have the Pfizer vaccine as their preferred vaccine. But what they haven't really made clear is, when this vaccine is going to be available, and are there situations where the AstraZeneca vaccine may be better for you? And I wanted to give some light and some information on that so you can make up your mind for yourself. First of all, the AstraZeneca vaccine is the predominant one that's available in Australia. And in Europe, it has been associated with clots in patients. A very specific type of clot, which seems to be immune mediated, and it's different to the type of clots we usually see with DVTs and people that have been in bed for a long time or long flights. But if we are assuming that all these clots that have occurred in Europe are due to the vaccine, then we're seeing about 6.5 people per million doses given developing a clot. To put that as a percentage, it's 0.000000625 or 652, percentage of people develop a clot, and 20% of them, so 1/5 of those people, will have passed away from it. So it's 222 cases in 34 million vaccines in Europe. It seems to be 4 per million in the UK. And in Australia, we've given under 1 million doses, and there was 1 case in Victoria. So it's not zero. But it is low, and I think the thing that makes people feel more comfortable is to compare this against other everyday risks. So I can help you with that as well. So the risk of getting struck by lightning is 1 in 1 million. So this is 6.5 times more likely to happen than that. But the risk of going for a drive of about 500 kilometers, 400 to 500 kilometers, is about 1 in 1 million of dying as well. Per year, we have an average risk of about 38 people per million die from a car accident, just whether they're the driver, a passenger, or a pedestrian. And if we were to compare it to clots, which we shouldn't really compare clots with clots because they're slightly different. The clots that we see in females on the pill are a different mechanism, but since it's something that a lot of people have talked to their doctor about in the past, I think it's worth knowing what the risks are. So per 10,000 women per year in Australia, 4 out of 10,000 will have a clot for no reason. If you're on the pill, that goes up to between 7 and 10 people per 10,000 per year. So that's cumulative. If you are pregnant, it goes to 20 to 30. The couple of days leading up to delivery and the day of the delivery, it goes between 300 and 400. So 3 to 4% of all women per year who are pregnant and delivering will develop a clot of some sort, compared to 0.0000652% of people that receive this vaccine. That being said, as we roll out the vaccine more, we may see higher or we may see lower numbers, and we may understand more about this process. So purely from a point of view of what is the risk of me developing a clot from the vaccine, it is very, very low, but not impossible. The younger you seem to be, the higher that risk seems to be. But you can't look at risk without looking at benefit. So there's always a balancing point for everybody. In the UK, they're advising that people under 30 should receive the Pfizer vaccine if possible. They should be given a choice. And the reason for that is that there's higher circulating levels of COVID in the UK. So they've got numbers to compare against. They can see what happens if you're over 30 and you get COVID, what happens to you. And in Australia, we don't have these numbers. So we have to rely on the data from the UK, from Europe, from the USA to determine what decisions we make here. But in the UK, if you're above 30 and you catch COVID, you're more likely to have a bad outcome than if you had to get the vaccine. So risk benefit quite clear. In Australia, there's very little circulating community COVID, usually zero. Last week we had a bit of a blip in Brisbane and northern New South Wales, but that can happen at any time, and we won't know that it happened until after it happened. And you see sort of cases pop up with contact tracing, and other people get diagnosed who already had it by the time that first one is announced. And if you're immunized, that's going to protect you. Now, the age that they've given here in Australia is 50. It appears, they haven't given the working or the reasoning why, but it appears that people who are above 50 that get COVID are more likely to have a bad outcome than if you were to get COVID under the age of 50, which is why they've suggested people do get the Pfizer vaccine in that group. That's all well and good. but the Pfizer vaccine really isn't available at the moment. I know people who are in phase 1A who are still waiting for their first shot of the Pfizer vaccine, and it will take time by the end of the year for that to roll out. The other thing to balance this against is short-term versus long-term risk and benefit. So right now, with borders closed, with quarantine occurring the way it is, the chance of me walking down the street and catching COVID is low. Me working in a health center increases because sick people concentrate at medical centers. People in hospital, it goes up again. So from an exposure point of view, the risk is different for everybody. But as a society, as a country, we're probably trying to move towards a time when we're able to travel overseas without quarantine. And though the numbers haven't been stated, a fair portion of the Australian population, particularly those at the highest risk of bad outcomes, will need to be vaccinated before we move in that direction. So if that is something that's coming up for you, if you are traveling overseas and you have an exemption to travel, your risk may be completely different. I received my first dose of the Astrozenica vaccine about 3 weeks ago, and yes, I did get a fever, and yes, I did get headaches. But 24 hours later, I felt fine. And knowing now that I'm on my way to being quite well protected against the severe, outcomes and severe consequences of COVID-19, as well as a significant reduction in my risk of catching COVID if I were to be exposed to it, makes me feel safer. I'm one of the 99.99999% of people who didn't get a clot from it. So I'm fairly happy of the way things went. I will receive my second vaccine because I didn't have any side effects from the first one that would prohibit me from getting that. And I think that's a question for a lot of people who receive their first dose. Should they get their second? If you've been well, then yes. Should you hold off getting a vaccine to see what happens? Yes and no, and part of that might be out of your control. If you're in phase 1B, and you're in phase 1B because there's a medical condition that puts you at highest risk of having severe outcomes from catching COVID, then I think without delving into the data, the vaccine, AstraZeneca or Pfizer, will give you more benefit than harm. 16% of people with COVID develop clots, significant clots in the lungs, clots in the legs, clots in the brain. A significant proportion of younger people develop long COVID. And if anyone's ever had glandular fever, they understand what it's like to feel tired and sick for 3 months. Long COVID sounds like it's much worse than that. I've got patients who are based originally from Brazil, South Africa, the UK, Italy. And when I ask them how their family's going, sometimes it's great. They're safe, they're quarantining, they're at home, they've had their first dose of vaccine, they feel better. But some of the stories I hear are quite harrowing. People that have lost family members that couldn't go visit them, that wish they could say goodbye. And I think it throws it back into context that what we're doing here in Australia is part of the global picture. The sooner we as a population are immunized against the original strains of COVID, the sooner we will be protected and our most vulnerable will be protected. And then we can start focusing on these new strains of concern as they come out, whether that's boosters, whether that's new vaccines. So for me, the vaccine program moving forward and people being vaccinated when they're in the right eligibility criteria and people being given the option and the information is very important. But I'm still not going to tell you whether you should or shouldn't receive the vaccine. I think it's a personal decision. We at Green Square Health will be offering it to people who are eligible for 1B ongoing. And if you understand that there are risks involved, we're happy to have you. I will release more information as it comes to light. When we learn more, when the statistics are updated, when all this information is there, I'll be sure to put it on our social media, on our blog. So please stay tuned for that. If you have any questions, chuck it on the social media in the comments. We'll try our best to answer them. I'll put this as a YouTube video. Please put your questions under there and I'll try my best to answer them as well. But otherwise, I hope this helps you make up your mind about how you want to do things moving forward. We're not stopping the program at Green Square Health. We're still getting 100 doses a week and we're still happy to give them out, particularly if you're over 50 and you're at risk. If you're under 50 and you have an eligible risk factor, we're still happy to give it as well. I look forward to seeing you on Thursdays when we give out the vaccine, and I really look forward to your comments and questions. Thank you for taking the time to listen to me. I'm Daniel Chanyshev. I'll speak to you later.